Welcome to our 5 on 5. Please welcome in Tomi Ryba, the CEO of Southern Oregon Service Area for Providence. Good to see you. Welcome.
Good morning. Glad to be here.
Thank you. So, Southern Oregon Service Area, how many or what facilities do you oversee?
So Southern Oregon for Providence represents our primary care clinics, our hospital, of course, at the Providence Medford Medical Center. And then, in addition, what we're really doing is trying to think about the 500,000 people that live in Southern Oregon, right? In Jackson, Josephine County, and all the way to the coast up to Coos Bay. And so my work is really thinking about how do we connect care across those communities. So it's, we have certainly the clinics and the hospital and things like that, but we also have the plan, the Providence Health Plan, that obviously serves the residents of the community. So it's about connecting all of those pieces.
Okay, and you're relatively new to the area, a few months on the job.
I am.
Correct me if I'm wrong. Okay, so
yeah.
Tell us a little bit about your background.
So I've been really blessed to be in healthcare for about 20-some years, and I think what brought me to healthcare in the first place was a heavy dose of altruism and wanting to be of service to others, being raised in a family that kind of taught those principles and values. And so I really got introduced to healthcare with public hospitals, having just a good chance to work with Riverside County Hospital, which is in Southern California, east of LA, and worked there for about 10 years in public space, serving about 2 million residents in Southern California. And then I moved on to really academic and community-based, so I've had a really privilege of working in different types of settings. So University of California, San Francisco, downtown San Fran, working with the University of Washington at Harborview, which is owned and operated by King County, but affiliated with the University of Washington. And then Silicon Valley most recently with El Camino Hospital, and then also got to spend some time in the Midwest, where my family comes from, in Minnesota, where I worked with Alina, which is about a $3.5 billion company that had about a dozen hospitals that served about 1 out of every 3 Minnesotans. Wow. So I liken the work here in Oregon very much to my work in Minnesota. So my experience has been mostly on the West Coast with a little bit of a departure to the Midwest.
Okay, and as I do want to ask you, and again, you're just a few months on the job, but I do want to ask you about a possible merger between Providence and Ascension Health. Can you give us a status report on those discussions?
You know, I don't have an update or a status. I'm aware there's conversations, but that's about it. Those conversations are held really at the system level in Renton, Washington.
Sure. Okay. All right. Well, we're going to take a quick commercial break.
Okay.
We'll have much more in a moment. Stay
Thank
with
you.
us. Welcome back to our 5 on 5. Again, we're here with Tomi Ryba, the CEO for Providence, Southern Oregon Service Area. So you guys have this beautiful new facility at, I believe, Stewart, Meadows, and Highway 99, South Pacific Highway. I guess Providence, Stewart, Meadows Medical Plaza.
Yeah.
Tell us about this and what excites you about this facility.
Well, a lot of things. First of all, it's a wonderful opportunity to expand our base and have better access for people who need primary care. And so housed in the Stewart Meadows Plaza really is primary care, urgent care, and it also houses a great program around sports medicine. So I don't know if the community is well aware, but Providence does a great job with sports medicine. We link to the community in different ways. We have trainers at many of the schools. We actually have these programs that are partnering with American Heart Association, as well as with respect to sports medicine, we actually have a program called Play Smart. And it takes kids, youth basically, who are doing sports and helps really assess their health and make sure that we can look for early detection, if you will, of any kind of cardiac distress. And so we do that, and we partner Play Smart with the local schools. But with respect to the American Heart Association, we actually partner with them, really looking at childhood obesity and childhood health, child health, if you will.
Sure, get ahead of these things.
Right, and so Healthy for Good is a program we're introducing to 5 elementary schools in Medford this week. It's a 6-week program that really helps educate children at a young age and then their families around healthy choices, whether or not it's zero sugar or really being active and what have you, but it's centered around heart health because we have a tremendous heart program led by Dr. Chris Cannon at Providence. And so he's very well connected with a lot of these healthy heart types of programs in the community.
Okay, very nice. And I do want to ask you, just a couple months ago, we welcomed in the CEO of Asante Rogue Regional Medical Center, Mig Zeblik, someone you're very familiar with from El Camino Hospital, an area I know well. Is that a positive that you guys, perhaps can take your personal relationship professionally and work together in any capacity? Yeah,
it just happened coincidentally, so it was really kind of fun. So I reached out to Mick when I heard that and learned that he was taking this opportunity and said, how can we serve the community better together? Seriously, because I think we have an opportunity in Southern Oregon, because we we're privileged to have such good institutions to serve the community. And I think if we can look at community benefit together, so what I suggested was maybe in areas of behavioral health, substance abuse, and aging. Those are the 3 areas that I thought would be just natural, because we're both serving the community. There's a relentless need for support of behavioral health, access to care, and then as well, with the aging of the population, there's so many homebound and isolated seniors that need our help. In fact, another partnership we're doing with Mercy Flight is that, Mercy Medic, is that they actually have a program where the paramedics will go into the home of residents who are isolated and homebound. You may be familiar with the program.
Yeah, they've talked about it here at the 5 on 5.
Oh, good. Well, Providence supports that program, and we partner with them on that. So I do think there's opportunities to connect and to partner with our providers in the community.
Excellent. Well, it's great to meet you. Thank you so much for being here. I appreciate it.
Of course, my pleasure.
Thank you. Stay with us. We'll be right back.